Journey of milestones. Yes. Now, for knowing the milestones, like if I ask you a very basic question, did you take the milestone history of this child? So, any milestone history will be taken in various domains. There are various domains of development. We have something known as gross motor. We have something known as fine motor. So, we have five domains of development. We have gross motor, fine motor, personal and social, and then we have language, vision and hearing. Language, vision and hearing. Understand the concept is very easy. Whenever I ask you whether the baby is growing well or not, you're gonna judge that baby into various domains. That in gross motor, what all baby can do, in fine motor, what all baby can do, then in personal and social, then language, vision and hearing. So always, forever and forever, you remember that, and you will tell me, it's like, sir, in the gross motor my patient can do this latest, in fine motor he can do this, in personal and social he can do this, like that you have to speak. So say with me, how many domains of development we have? Five domains of development are there. We have gross motor, fine motor, personal and social, language, vision and hearing. Okay, these are the five domains. Always remember: gross motor, fine motor, personal and social, language, vision and hearing. Okay, number one. Next important point we have is, after this, gross motor. Gross motor, like grossly what all a baby can do. So in this slides, no, all videos are there, so that you can have a very beautiful comprehensive one second. Yeah. So I'll just mute this voice. Yes. Now look at this baby right now. Now, in the gross motor, this is very important point. In the gross motor, I am doing something known as, very importantly, something known as neck holding. In the gross motor, very commonly they ask in an exam, when can a baby does a neck holding? The answer is 3 months. A 3-month-old baby can have a neck holding. Let's watch this video again, 1 second. So in this video, I'll repeat again. Yes, this is the one slide, and I'll just do back also. Sometimes it all hangs here and there. That's why. So remember, always we have gross motor, fine motor, personal and social, language, vision, and hearing. So in the gross motor, the first video which I showed you over here is this one. So I am doing pull to sit. If you look at this baby, if you watch this video again, baby lies supine, and I take the both hands of the baby and I'll look for pull to sit. This is known as pull to sit. Now, sir, why, Anand sir, why are you holding the baby like that? Pull to sit. Now, in the pull to sit, my dear friends, in this one, basically, I am checking the neck holding. Is the neck totally head lag is there, or the baby can have a neck holding? So this is important point. Must appreciate for exam purpose. The neck holding. If I ask you a simple question, neck, when does neck holding comes? The neck holding comes by 3 months, 3 months, and 3 months. Okay, video based memory. Neck holding, a baby can hold his neck by 3 months. Next important point. Now this also video based, again to your question. See, now this baby also, see, is holding the neck. He is holding the neck. This baby is holding the neck. Now in the neck holding, remember, 3 months, 4 months and 5 months. Very important for exam purpose. 3 months, 4 months and 5 months. Neck holding with the head lag. Neck holding with head लैग, आई से इन हिंदी एंड इंग्लिश. बच्चा गर्दन तो संभाल रहा है, हल्का सा ऐसे टिल्ट हो रहा है. सो नेक होल्डिंग विद हेड लैग कम्स बाय 3 months, एंड नेक होल्डिंग विदाउट हेड लैग, with neck holding without head lag comes by 4 months, and complete neck control comes by 5 months. Complete neck control comes by 5 months. So 3, 4, and 5. These three things you should know. So I'll repeat again. Neck. See, in simple, if I ask you, when does neck holding comes? Simple. When does neck holding comes? Then you will say answer is 3 months. Okay. But detailing, neck holding with the head lag comes by 3 months. Neck holding without head lag comes by 4 months, and complete neck control comes by 5 months. And 5 months, one more thing comes, that is mouthing. That is mouthing. Doctor, जो भी दो मेरा बच्चा मुंह में डाल लेता है, जो भी दो मुंह में डाल देता है. Whatever you give him, he put in the mouth, known as mouthing, comes by 5 months. Let's revise again. You're reading this for the first and last time, okay? And this is a bread and butter forever, 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 forever. You should know this, okay? In your clinic, in your classes, everywhere this question comes. So there are various domains of development. We have gross motor, fine motor, personal and social, language, vision and hearing. In the gross motor, grossly, mota mota बच्चा क्या कर लेता है? Grossly, what all baby can do. So number one, neck holding comes by 3 months, neck holding without head lag 4 months, and complete neck control comes by 5 months. This is how the MCQs comes usually. That neck holding. Now this question simple. Neck holding comes by. So neck holding comes by. Remember the answer is 3 months. If they ask you like that, when does neck holding comes, then the answer is 3 months. Now if I put the baby in ventral suspension, this is very interesting. If I put the baby in ventral suspension, so this is known as ventral suspension. See, now I put this baby right now in the ventral suspension. So ventrally, this is the perfect thing. So I have put the baby in ventral suspension means like I put the baby on my hand, and ventral, this whole part. And in the ventral suspension, now very importantly, one thing I will see, one second, in the ventral suspension, if I just pose it like that and put a marker, so I'll see baby's head. This is the level of horizontal plane. This is nothing but the horizontal plane. And I'm again checking the neck holding only. I'm checking whether the head, this head, whether the head is below the level of horizontal plane, at the level of horizontal plane, or above the level of horizontal plane, above the level of horizontal plane. So these three are exam question. If you put the baby in the ventral suspension, the baby's head is below the level of horizontal plane, at the level of horizontal plane, or above the level of horizontal plane. कि बच्चे का सर बिल्कुल लटका हुआ है, थोड़ा सा स्ट्रेट लाइन है, या उससे भी ऊपर है. And the answer is, it comes by 1 month, 2 month, 3 month. The baby, if you put the baby in the ventral suspension, if the baby's head is below the level of horizontal plane, the baby is 1 month old. If the head is at the level of horizontal plane, the baby is 2 month old. And baby's head above the level of horizontal plane, the baby is 3 months old. So 1 month, 2 month, 3 month. Never ever forget. Okay. Now, next question. What is the probable age of the baby? Now, it's all picture, and answer. Now, there are two types of baby I'll show you. See, this is normally his pronated position is sleeping. Now, in this picture, he has a high pelvis. In this picture, he has a high pelvis. Okay, high pelvis. How do you know he has a high pelvis? Because if I show you one more picture, this baby has a flat pelvis. This baby has a flat pelvis. So this is the flat pelvis, this is the high pelvis. Now high pelvis, this picture comes by 2 weeks where the baby has a high pelvis, and around roughly by 6 weeks, the baby will have a flat pelvis. So this is quite interesting. By 6 weeks, the baby, he will lie supine, but he will have a flat pelvis, and 2 weeks baby, he will have a high pelvis.